Uterine fibroid. Uterine fibroid. Noncancerous growths of the uterus that often appear during reproductive years. It is not associated with an increased risk of uterine cancer. Characteristics, sizes. From undetectable sizes to bulky masses that can distort and enlarge the uterus. Numbers. From 1 to many. In extreme cases, multiple fibroids can expand the uterus so much that it reaches the rib cage and can add weight. Classification by locations. Intramural fibroids grow within the muscular uterine wall. Submucosal fibroids bulge into the uterine cavity. Subserosal fibroids project to the outside of the uterus. Symptoms. Asymptomatic. Menorrhagia, menstrual bleeding that lasts more than 7 days. Pelvic. Pressure or pain, backache or leg pains. Frequent urination, difficulty emptying the bladder. Constipation. Risk factors. Race. Black. Heredity. Starting your period at an early age. Obesity. Vitamin D deficiency. Diet. Higher in red meat, lower in green vegetables, fruit, and dairy. Alcohol consumption. Causes. Genetic changes differ from those in typical uterine muscle cells. Hormones. Estrogen. Progesterone. Many fibroids that have been present during pregnancy shrink or disappear after pregnancy, as the uterus goes back to its usual size. Other growth factors. Insulin-like growth factor. Extracellular matrix, ECM, makes cells stick together. ECM is increased and makes them fibrous. Diagnosis. Ultrasound. Transabdominal or transvaginal to get images of the uterus. MRI. 4. Images in more detail. Hysterosonography. Expanding the uterine cavity with saline to get images. Hysterosalpingography. Uses a dye to highlight the uterine cavity and fallopian tubes on X-ray images. Hysteroscopy. Uses hysteroscope through the cervix into the uterus, then expands the uterine cavity with saline to examine. Laboratory test. Complete blood count for anemia due to chronic blood loss. In many cases, fibroids can cause a heavier menstrual cycle and anemia. Treatment. Nothing but observing. In many cases, asymptomatic or only mild symptoms. They are not cancerous and rarely interfere with pregnancy. They usually grow slowly or not at all, and tend to shrink after menopause, when levels of reproductive hormones drop. Drugs. Gonadotropin-releasing hormone, GnRH, agonists, shrink the size of them. E.g. leuprolide, goserelin. Triptorelin. Tranexamic acid, ease heavy menstrual periods. Oral contraceptives. Control menstrual bleeding, but not shrink or make them disappear. Nonsteroidal anti-inflammatory drugs. NSAIDs, relieve pain, but not reduce bleeding. Vitamins and iron, for heavy menstrual bleeding and anemia. Progestin-releasing intrauterine device, IUD, relieve heavy bleeding, but not shrink or make them disappear. Also prevents pregnancy. Uterine artery embolization, shrinks them by blocking off their blood supply. Magnetic resonance guided focused ultrasound, MRGFUS, MRI for vision and planning to treat, over 1,000 beams of ultrasound to concentrate and focus on the target. To burn, a non-invasive procedure. Ablation, destroys them by heat. Radiofrequency ablation. Radiofrequency energy destroys them and shrinks the blood vessels that feed them. Endometrial ablation, uses heat, microwave energy, hot water, or electric current to destroy the endometrium. Effective in stopping abnormal bleeding, but it hinders to get pregnant, Birth control is needed to prevent ectopic pregnancy. Cryomyolysis freezes them. Myomectomy removes them. Laparoscopic procedure makes small incisions to insert a laparoscope and surgical instruments. It may be removed after morcellation, cutting into pieces, or as it is. Laparoscopic copotomy is performed through the vagina, a minimally invasive procedure. Robotic myomectomy, a type of laparoscopic myomectomy that uses a combination of high-definition 3D magnification, robotic technology, and miniature instruments. A minimally invasive procedure. Abdominal myomectomy makes an incision through the skin on the lower abdomen, bikini cut. An invasive procedure. Hysteroscopic myomectomy removes them through the vagina and cervix. A minimally invasive procedure. Hysterectomy removes the uterus. An invasive procedure.